Dear friends, I am Dr. Hemraj Chandalia. I'll discuss today a very interesting practice that is being followed by our patients when before they see us. And that is doing a plethora of tests before seeing the doctor with a fond hope that will make doctor undertake very rapid decisions. But I will tell you that why you should avoid following this practice. So you obtain a large package of 30 to 40 tests given to you as a package with the fond hope that tests done before the consultation will guide the doctor into a very prompt and appropriate action. I must tell you that this may not happen. For example, the package which contains 50 tests even sometimes may not include the test that you really need, and that can be decided only after patient has seen you. For example, I can tell you that complete health checkups in many hospitals conducted with a waste of half a day's time and a large amount of payments. In a diabetic, it does not contain a spot urine test for microalbumin or albumin creat ratio. And after everything is done, the patient is told, "Sir, you have diabetes." Patient already knew he had diabetes. What he wanted was appropriate evaluation further. So you are going backwards when you do this kind of test. So many tests not required are included in the packages. Most of the time, these are vitamin estimations. Remember, if you are taking the prescribed dose of vitamin B12 and D, you do not have to do the tests of vitamins again, which is quite expensive test. And some laboratories, interestingly, were doing all metal assays in the blood, arsenic, cadmium, chromium, molybdenum, all those, which are very rarely of any importance. And I saw hundreds of those results and did not find any abnormality. So I was wondering why they were conducting so many tests. And cancer markers do not really detect cancer easily. They all detect also in the long run, and most of the time is a big waste, except probably the prostate-specific antigen PSA in elderly people who already have prostatic enlargement to see emergence of prostatic carcinoma, which is commonest cancer in men. So there it is sometimes helpful to do, but most of the markers are quite useless unless done in the background where the person needs. So besides getting the test done at discounted rate, the patient, because there are so many unnecessary tests, will be paying up much more for the redundant tests. So I think that is financially not a very good decision for the patients. And remember also, in packages, some tests are not conducted in the manner that we want. So I'll tell you one example. For example, LDL, that is bad cholesterol, which is what we are really looking for to decide whether we should give you treatment with statins or cholesterol lowering agents. You see, in a lipid profile, most of the laboratories will calculate this based upon some other parameters. So it is done by a calculator. It is not estimated. So the doctors understand, and when they are really specifically looking at your lipids or your cholesterol, they will request that LDL cholesterol is done by a direct estimation and not calculated. So a lot of your testing may be worthless because the laboratories generally do them by some method which is very expedient and which is easy and economical to them. Also remember that reference values given there, some patients think that they can diagnose things by looking at which are the tests which are abnormal and they are in the bold type or underline or italicized. They think that they can have the diagnosis. This is not the way you lead to any diagnosis. For example, you think by doing the test in advance that you will get very useful information about your diagnosis and treatment. So for example, LDL cholesterol, which is our target for treatment. Now the reference range that the laboratory gives you is less than 100 is normal. But the doctor's desire less than 70. So when you have 100, you think that I should not receive treatment, while doctor knows that he has to treat it and lower it to 70. So that results into misunderstanding between your physician and yourself. And of course, remember Similar way, for example, thyroid, TSH, a very common test done. The laboratory normal is 0.3 to 4.5. And when we treat a person who has hypothyroidism and we give the thyroxine, you see, when we reach 4.5, they say this dose is fine, you'll think that way. But you know what is our target? Our target is less than 2. So there is a discrepancy between what lab writes and what doctor wants. So again, doing this and interpreting is difficult for a non-medical person. So trust your doctor. The doctor knows your best and let him or her order the test you require after a consultation. Thank you very much.